And I'd like to introduce Dr. Balmoria. She is board certified in family medicine and earned her Doctor of Medicine degree with an honors certificate in underserved medicine from VCU School of Medicine in Richmond, Virginia. She completed her residency at Inova Fairfax Hospital. Dr. Balmoria is a member of the Society of Teachers of Family Medicine. She is the recipient of multiple awards, including one for practice recognition and another for community preceptorship. She has special interests in general pediatrics, women's health, mental health, obesity, and end-of-life care. And she speaks English and Spanish fluently. So now I will turn it over to her and she's going to talk about teen health.
Thank you. All right, so hi everybody. One of the things that I'll add, because this talk is about teen health, is I'm also the mom of an 18-year-old boy who's currently trying to figure out where he's going to go to college. And so I'm looking at this from the perspective of a parent as well as a physician. And so I think that kind of helps. Seeing it from the other side is very different. So welcome. These are sort of like the caveats to the talk. Obviously, I'm not giving medical advice for all humans in this talk. And so, you know, everyone should talk to their own provider about what the best thing is for them as an individual and not make sort of your decisions based on generalizations. I am going to talk about some sensitive topics today, and depending on your point of view, you might not like what I have to say, but the stuff that I'm giving you is based on research and science. And so it's you know, coming from a place of this is what we know to be the best information that we have available at this time. When I was talking to my colleagues about things that we really want people to know about healthcare in teenagers, one of the things that came up, and actually this came up from patients of mine as well, is that it's really important that people understand that when kids come in for visits with us, they are not obligated to consent to whatever thing that we're recommending for them. And one really good example of that is the genital exam, especially for like sports physicals. That's a big thing that comes up with teenagers that makes them really uncomfortable about even participating in sports. Some of them will just be like so uncomfortable about it, they don't even want to do the sport because they don't want to consent to that exam. They don't have to do that. And you can play sports and not have a doctor do that exam, and it is fine. Another way that this will sort of come up is for a lot of teenage girls when they arrive at the age of having periods. It's not unusual for a caregiver to bring them into the office and say, well, it's time for their first pelvic exam because they have periods now. And that's not a thing. Periods are a normal physiologic process. They don't require an examination of any sort. Needing medication for periods does not mean that the child will have to submit to an exam. And young girls in particular, those like sort of 10 to 14-year-olds who are having symptoms that are worrisome that require a pelvic exam, typically what is supposed to be standard of care in this country is that those children would actually be referred to, in our case, Richmond, to undergo an exam under anesthesia. Because it's just not considered appropriate for that age to be having a pelvic exam wide awake. They're not physiologically in a place where that's appropriate, generally. So again, these are generalizations that are not specific to every single human. Okay, so going on to what we're actually going to talk about today. The first thing that I wanted to talk about were shots, because that's a really big thing that we talk about with kids in general. I'm going to specifically target the vaccines that we recommend to that 10 plus age group in kids. I think most people know that in order to go to school, and in Virginia specifically to start 7th grade, you have to have your Tdap. Tdap is a whooping cough booster and tetanus and diphtheria all built into one shot. And that's good for 10 years once you get it. So that's a really good thing, I think, for my older teens to know that usually they're going to not need a booster until they hit their 21st or 22nd birthday, depending on how old they were when they got their Tdap. And then the other vaccines that we recommend for teenagers are the HPV, or the Gardasil is the brand of that vaccine, and the meningitis vaccines. And then of course, everybody now who's old enough are recommending COVID vaccination, and then the flu shot once a year. And then if there's something they did not get when they were younger, for some reason they missed some shots, then we might recommend catching up on those. I'm going to go through each of the I think the Tdap is fairly straightforward, but the other ones we're going to go through individually. So HPV is one of my favorite vaccines because it's the only one that prevents cancer. There are actually some other vaccines coming down the pike that may do this work as well, FYI. Stay tuned. There might be more of these in the future. There's some in trials right now, but right now, the only one we have is HPV. It used to be only for girls, only young girls. That has changed. Now it's all the way up to age 45 for both genders. It prevents multiple cancers. So it prevents cervical cancer. I think that's the one that it's the most famous for. Cervical cancer is the type of cancer that we do pap smears to look for. And so I think most women kind of understand that you have to get a pap. Some people understand that it's to look for cervix cancer. Some people don't. The test now that we do pap testing. One of those tests is often to look for HPV, so the virus that actually has been shown to lead to cervical cancer in some patients. And so getting this vaccine makes it more likely that you will never have an abnormal pap that requires further evaluation or treatment. And it means that your risk of cancer goes down by about 90% in that cervix cancer specifically. But it also prevents genital cancers in men and rectal cancers in both genders, and it prevents genital warts. And I think the biggie that I think is really cool is that it prevents head and neck cancer. So one of the things that we don't really think about when we talk about sexually transmitted infections is that you get them in your mouth and your throat too. And that's true of many different STDs, but HPV specifically in your mouth and throat can lead to cancer. And I actually have a patient right now who's undergoing treatment for HPV related head and neck cancer. And if you have not been a big drinker or a big smoker, this is the #1 reason for you to get a head and neck cancer. And I think anyone who's been around someone who's gone through that cancer treatment process can tell you head and neck cancer is not something anyone wants to have. Specifically with this vaccine, it's currently recommended as 2 doses total for the whole series. If you start it before you turn 15 years old, after 15, 3 doses. I will say just this week, new information was given by WHO that now says that you should maybe only need 1 dose if you start before the age of 20. And that's the World Health Organization. That's not our CDC. The guidelines have not changed in this country, but they might at some point. And so just another thing to know that we're not exactly sure what the guidelines will be in the long term, but we do know that getting this vaccine reduces your risk of cancer substantially. COVID vaccine. This is another really hot topic, lots of changes. Obviously, there's a date on the first slide. And so those of you who are watching this recorded later, who knows if this is still true. Right now for kids 5 and up are FDA approved for Pfizer vaccine only. Nothing else is FDA approved for kids at this time. If you're interested in sort of diving into the data, specifically looking at kids, these 2 Instagram feeds do very specifically target that data and look very closely at the risk benefit ratio in kids vaccinations specifically. And they also just talk about, they do a lot of really good sort of infographics about understanding health information and data and how to interpret data. And it's really great to have these 2 very savvy women sort of giving very, very concise, simple to understand information about how to know if what you're reading or looking at on Instagram or on the internet in general is true, or if it's just misinformation or just basically somebody trying to make money. And so I really like these 2 folks. They've helped me a lot to sort of figure out how to explain things to people. And they also use references so you know that their information is coming from what sources, basically. And so the next slide kind of dives into specifically some of the things that I have pulled together about kids. And I do have references on the very last slide. And I think for those of you who are around teenagers, this is really helpful too. If they want to do a presentation for a class, or you want to help them to learn about how to tell if information is accurate or not. All of the references that I've put at the end of the presentation, I think are good starting points for people to learn about how to know what is scientific data and what is not, and good examples of how to find your information. So I think really big takeaways for people who are thinking about COVID vaccine in kids. First of all, the side effects for the vaccines were basically the same as placebo in the trials. So when people who are worried about side effects from vaccines, literally almost no difference. And so, yeah, your arm might hurt a little bit. That's true if we inject salt water into your arm too. The rate of things like headaches or upset stomach and all of those other sort of minor things that can happen after a vaccine, again, very little difference in children specifically. And that's not the same as with the adult trials. And so I think it's important to distinguish between those. As far as what the benefit is to kids, as it says on the slide, we can vaccinate 1 million children and we will only save 1 life, right? So this is not really that impressive compared to, say, like the measles vaccine and what it has done for humankind. But still a really big deal in the sense of it does prevent 40,000 infections. And there are hundreds of kids who are saved to hospitalization. And I think just as importantly, the heart effects of COVID. And those are the ones that we really, really want to keep from happening. Now, I did not put up data about how much we think vaccinating kids is going to help the adult population or help public health in general, right? And that's a whole other aspect of the benefit of the vaccine that, you know, could be talked about is like, well, if you avoid making grandma sick enough to land in the hospital, is that worth the kid getting the shot? Right. And I didn't dive into that data, but that's obviously another argument for vaccination. From my point of view as a parent, the myocarditis risk was probably the #1 reason that I was really enthusiastic about getting my child vaccinated as soon as possible. He is an athlete. He likes to run distance. He hopes to run marathons as an adult. And myocarditis can really ruin your exercise capacity. Mostly it seems to be short term. It doesn't seem to be something where people are permanently affected by it, but we don't really know the answer to that in the long run. And of course, it's impossible to say, well, if that kid had never gotten myocarditis, would they have been able to run a minute faster? Right? Nobody's ever going to be able to prove that one way or the other. And so just even the tiny, tiny improbable possibility of that, even though it's like a, you know, maybe 1 in a million kind of thing, to me, that was enough to make it worth the bother. Now here, I have to say a lot of the patients that I've been seeing in the office have already had COVID, you know, and so the question is, well, what do I do with those patients? And the England actually recently put out data showing that the kids don't seem to be getting reinfected at a very high rate. We're talking in the like 0.5% range getting reinfected at this time. And so if you have a child who's had COVID, you know, honestly, I don't know that you're going to do a whole lot to help them with the vaccine right now. But of course, we don't know how long that immunity is going to last. And we don't know what's going to happen with variants in the future. And so there's no way to know kind of what your long-term strategy should be regarding vaccination. Okay, next topic. So we're done with vaccines. We're going to talk about gender. I could talk about gender for hours, maybe days and weeks, because it's so interesting. I think for teenagers and as a group, like all of them have some sort of issue related to gender at some point as they go through puberty. There are basically 2 times in our lives that what your gender is becomes really interesting to you. The first is around kindergarten, so that 4 to 6-year-old age group. As somebody who used to teach kindergarten, I can tell you this time of year, it was really normal to have a little collection of boys somewhere on the playground pulling their pants open so they could look at each other's parts and talk about what it's like to have those parts, and to have to go over as the teacher and be like, you cannot do that in front of other humans. Like, this is really not okay. And let's talk about like when it is okay, because it's not okay here on the playground. And so that's the first age. The second age is actually around the time that kids hit puberty and their bodies start to change. And there are all kinds of problems. And I think all of us, if we think about being teenagers and how just sort of earth-shattering puberty can be, can think of moments in our lives where the fact that we were going through puberty and the fact that our gender was obnoxious, right? And there are small examples of that, like, you know, for myself, I was a fairly late to hit puberty kind of person. And so I was one of the last girls in my class to start wearing a training bra. And it was sort of awkward in the locker rooms because people just weren't shaped like I was shaped. And that was awkward for me sometimes. And then there are the sort of bigger, scarier things like having, you know, a child who looks like she is 16 when she is actually 11 and having to deal with people trying to ask her out when you're just walking around Walmart and she's 11 and they're like 20, and all of the issues that go with that. There's a whole host of problems that come along with puberty. This particular website that I've put the YouTube link in here for, I'm not going to play the video during this presentation because you can do that yourself. Amaze has dozens and hundreds of videos that are quite brief that talk about individual topics that are related to teen health. And they do spend a lot of time diving into gender in their sort of giant library of videos. And they're not, because they're so short, I think it's reasonable to like consider watching them maybe on your own first to see if you feel like it kind of addresses the topic the way that you want it to be with your kid. And then, you know, watch it together and kind of open the door to having a conversation about how your child feels about it. To dig into that a little bit more into like the sort of hot topic of transgender stuff, I'm going to go into that some on the next slides. I think the important thing for people who are around teenagers to take away is our job as the adult is to try to keep ourselves emotionally centered and not to get overly excited about any particular thing, but to listen and be supportive. And so that's job number one. Our job is to be the supportive adult for whatever's going on in the universe. And then the second layer is if we feel over our heads or out of our depth about what is going on and it's worrying us, to get appropriate expert help, to get guidance, to be like, I don't know what to do about this. So going on to the next slide, that's basically what this says, right? And it's really, I think, extremely challenging when you have a teenager who's like being really upset, really emotional, and maybe going in a direction that you really don't feel like supporting, to just be open-minded and say, look, I'm here to help you to be healthy and to grow up into the person that you need to be, and tell me what I can do to help you, right? And if we're showing up with that kind of attitude, you're going to set yourself up from a medical perspective to be successful in raising a child who is able to meet whatever their needs are. And so we go on to the next slide. So this is very specific data for transgender patients, but I want to say that I think that the data is pretty consistent regardless of somebody's gender identity, right? So for a kid who is a totally heterosexual, cisgender, I use the pronouns I was born with person, all of these statistics that are on this slide are true for them too, in my opinion. That's not based on like a survey that I did or anything. I'm just saying the difference between kids who are emotionally supported by their family and feel like they can talk to their caregivers when things are bad is massive. That is the end all be all of good mental health in teenagers. And it's really very similar if you look at data for preschoolers. And I think it's really important as a parent of a teen to think about the support that you need to be providing these children is just as much as you provided to them when they were starting kindergarten, which sounds bonkers, right? We think about older kids as being like, they should be more independent, they should be doing more, they should be more sort of self-sufficient. But from an emotional standpoint, because of what they are going through hormonally and physiologically, they need all of the support that a 5-year-old needs when they're going off to school for the first time and they've just started not taking naps. That's how much work you have to put into them if you want them to be healthy. And so for my trans kids, for my kids who think that they might be lesbian or gay or bisexual, that is super, super, super more important, because for these kids, they're going to have more difficulty feeling supported by their peers and by humans out in the public sphere. And if we don't support them at home, the chances that they're going to end up hospitalized because they tried to kill themselves is incredibly high, super high. And it's absolutely terrifying to us as doctors that this is a completely preventable problem. And all we have to do is have supportive homes for these kids. It's not a medical solution. It is a community solution. It is a social solution. And so this isn't something that I can fix as their doctor. This is something that only their caregivers can fix. And I want to really point out in the middle of this slide that statistic on the fact that 50% of all teenagers are not comfortable talking to their primary caregiver, so their parent or grandparent or whoever their person is, about something that really bothers them. Half of them. That is a nationwide survey that's conducted on a regular basis. That is not an okay statistic. We're not doing our job for these kids as parents. We're just not, you know. This is just a slide that I'm going to kind of breeze through, talking about the problem of homelessness in the LGBTQ teen population. If you know anybody who has a place in their heart to consider fostering for these kids, there's a huge need for that nationwide. There are a lot of foster parents. There are not a lot of foster parents that are okay having a kid who identifies as trans and uses they pronouns in their house. There's just not. And there are a lot of kids who get basically kicked out of their house or driven out of their house because they're completely unsafe in it and they have nowhere to go. So if you know anyone who feels like they could figure out how to do that, support them. And then this is a support group in Clarksville that's meeting just like in a few days. So if you know a teenager who is not sure about their gender identity or not sure about their sexuality, or just wants to be an ally for these kids, take them. Go learn something, right? And I'm going to go on to the next slide, and we're going to move on to a whole different topic, which is periods and contraception and pregnancy. So this is sort of like the female sexual health kind of part of this talk. I'm going to start with the pregnancy statistics that are sitting up on this slide. I first of all just want to say that it's not that terrible. Okay, so teen pregnancy in Virginia as a whole is not terrible. It's not like a hugely prevalent thing. Teen pregnancy has been on the downswing nationwide for quite some time. We're doing a whole lot better with preventing teen pregnancy. And I think as somebody who provides medical care, I think we do a much better job of making contraception available to teenagers in the last sort of 10 years or so. And I think that's a wonderful thing. So locally, we are above the state sort of average. So we had a rate of 12.1 per thousand teenagers, and Virginia has a rate of 8.9 per thousand. So we're like a little bit above them. Petersburg has the worst rate in the state. I have that down there at 34 per thousand. Most of the teen pregnancies in Virginia and nationwide are in 18 and 19-year-olds. And so that's also a positive thing that we're not seeing, you know, folks under the age of 15 pregnant frequently. And the vast majority of our teenage pregnancies are typically in 18 and 19-year-olds. And all of that is to say that we've made really good headways in preventing teen pregnancy. Why do we care about preventing teen pregnancy? Well, for medically speaking, it's much healthier for mom and baby if mom is over 20 when she conceives. The rate of preeclampsia, preterm birth, and just bad outcomes are just higher for girls who are under the age of 20. So even if a woman wants to become pregnant at the age of 18, medically speaking, it's not in her or baby's best interest for her to choose to do that. Now, there are lots of reasons that, you know, waiting on pregnancy is a good idea, but medically speaking, that's the main one is it's just better for mom and baby if people wait. So this first slide is one of 4 pages, this picture that's listed here that is in the link that's at the top of this slide. And so Reproductive Access is a nationwide sort of nonprofit that puts out information about contraception and pregnancy. And this is a PDF file that they have produced, and it's available in multiple languages, that it basically gives you every single thing that there is that can be used for contraception. And so this first page is stuff that's actually not even a prescription that you can just go and pick up yourself. But there are other pages that sort of go into the pros and cons and the you know, how well it works and all of that for each and every single item. FDA has a somewhat similar list. And then at the end of these slides, there's more references that you can sort of look at for things about contraception. Why do we spend so much time talking about contraception besides pregnancy prevention? The main reason is because it's such a huge problem for so many girls. Periods are a problem. It's not really even so much pregnancy prevention for a lot of teens, because the wonderful thing about teenagers is they don't have sex as much as we did. And when I was a teenager, like people are waiting longer to start having sex. And so it's not often about pregnancy prevention. It's usually about periods and how horrible they are. And so one of the things that I do when I'm talking to all of my teenage girls who are in for a well child check is to talk about periods and say, well, how are they? Ask specifically, do you ever miss school because of your period? Do you ever have to not go to an activity that you would want to go to because of your period? And that's a very large number of girls will say yes to those questions. And I'm here to tell you that women and girls should not be missing work or school because of periods. They just shouldn't be. There's no need for that. Why do you have a period? Because you have a lining inside your uterus that is to grow a baby. And if you're not growing a baby, you don't need it, so it comes out. If you are not trying to get pregnant, you do not need that lining for anything. It does nothing for you. It is to make babies. That is what it is for. And that's the only reason. So if you don't like your period, if your period is keeping you from functioning, you should be doing something about it. So why do people have periods that are problematic? So some of this is just physiologic, weird hormone stuff that teenagers go through, but there are medical conditions that can make periods terrible. Having changes in your weight especially can make periods different and sometimes bad. Being stressed, of course, I think most women who've had periods for a while have known that they've had a period that was different than their usual because they were super stressed out. If you have cramps and you don't like them, over-the-counter ibuprofen is the most effective non-hormonal treatment for cramps. If you're taking that and it's not working, you probably need to talk to somebody about that. When you start having periods, it's very genetic. It is also quite weight related, and that's another big counseling topic that I share with my well child checks. Those girls that are quite over the 95th percentile for weight are at very high risk of starting their periods at a younger age. And the big downside of that, besides the annoyance of having a period when you're in 3rd grade, is that your bones will stop growing sooner. So women and actually boys who are obese, the hormones that are created by all of that fatty tissue cause you to have your growth plates close faster, in addition to making you start puberty. And that means those girls will not be as tall as they would have been had they been a normal weight. That is usually that stops a parent in their tracks when we're talking about, hey, we need to talk about weight. When we talk about, hey, your kid might be an inch shorter than they would have been because their weight was not healthy. That's a big deal for most people. Other things that I think are really important about periods, I get a lot of, well, periods are natural and you just have to live with it. And that is really not okay from a medical perspective to say to children, unless you are 100% sure that what they are experiencing is normal. Because as it says here, there are conditions that cause irregular periods that increase your risk of endometrial cancer. One of those conditions is PCOS, or polycystic ovarian syndrome, which is extremely common in the United States. You need to be diagnosed with that condition so that we know that you are at higher risk for cancer and infertility and other problems, right? Endometriosis is a condition that is also extremely common, often goes undiagnosed because the only way to diagnose it is with a surgery. You have to do a laparoscopy, look with a camera to see if it is there. And so a lot of women never go through that process. It's too invasive and they just don't want to know badly enough to risk the anesthesia and a surgery and all that. And certainly in a teenage girl, we're very reluctant to take them to the operating room to prove they have endometriosis. But if they're having really terrible cramps and a lot of pain with periods, we have to think about whether endometriosis could be the cause. Because if we leave that untreated and we don't give them hormones, that teenage girl may end up never being able to carry her own pregnancy, because endometriosis can cause so much scarring in the tubes and along the ovaries, they end up infertile. And so to just be like, oh, you have bad cramps, just stay home from school once a month and don't do anything about it, is really setting that child up for potentially a pretty serious consequence later in life. And so again, It is really not okay to just tell somebody that periods are supposed to hurt and your bleeding is supposed to be kind of heavy and it's fine. You need to talk to somebody if it's enough that they're missing school for sure. And then the last thing on this slide, and this is 100% true, there's been a study that showed that if you supplement menstruating teenagers with iron, you can actually see improvements in GPA. A lot of girls are not big meat eaters. A lot of them don't really get their iron in their diet. You know, a lot of teenagers, we're going to talk about that. The nutrition thing is a problem. You add in heavy periods to that, it is really hard for them to keep up on their iron demands. So think about like just those little kids, Flintstones with iron tablets, if you have a girl who has periods in your house. Okay. So this is, the rest of this is going to be pretty, I think, quick and straightforward. So sleep, everybody knows that no one sleeps enough pretty much. Teenagers, you know, a lot of parents will be like, oh, they'll sleep till noon if I let them. And of course, they have to be up early for school. They're often up late at night. If they're in activities, it's hard to get them to bed anyway. And then they just don't really feel like going to bed early enough to get enough sleep before their school day starts. As I said earlier, physiologically, teenagers are most similar to like kindergartners. They really do need quite a bit of sleep. They need routine, they need structure, just like 5-year-olds. Part of the reason a lot of teenagers are sort of irritable and grumpy isn't just their hormones, it's they're sleep deprived and they're not eating properly. And again, it's our job as parents to provide that routine and structure to be like, no, you know, you really got to go to bed. And if it comes down to it and you have to like literally take their phone away from them or unplug their video game console or computer and just take the power supply away from it so that the screens are off, do it. You know, have a curfew for screens. You know, be like 9 p.m., we're done with the screens. That's it. Or 10 p.m. or whatever the time is that works for your family. As the adults in the house, it's up to us to provide that routine and structure with the hope of giving them sort of the foundations they need to be successful adults and to be able to like build on that, to be like, okay, as a grown-up, these are the things that I just kind of have to get done every day to function. As it says here, you do have to figure out also how to give teenagers privacy. You can't just be wandering into their room at all hours to like see if they actually went to bed. And so sort of working on them to help them move towards adulthood, but also again, giving them structure. There's some really good data suggesting that even like the stress management programs that are apps that you can download to your phone do help kids to improve their sleep. And so if you have a child who just has a really hard time falling asleep, I think a lot of people now are reaching for like melatonin to help their kids get to sleep. Apps are for mindfulness and stress reduction are actually pretty effective at helping kids to increase their sleep. And so consider using those sort of non-medication or supplement type strategies to help your kid. And then the last thing I'll say about sleep is this is another area where there have been very good studies that show even just an additional 15 minutes of sleep a night improves grade point averages in teenagers. So it really does make a huge difference if you can get them even a little bit more sleep. There's an impressive improvement in what they're capable of. For nutrition, I give basically all of my patients the same nutritional advice once they're old enough to be off of baby bottles. And that is everybody needs 5 servings of fruits and vegetables every day. That's 2.5 cups. They need 3 servings of protein and they need 3 servings of calcium. That's it. That's all you need, plus whatever you're going to burn. What you're going to burn is going to depend on your physical activity. So when my kid is running and he's running 7 or 8 miles at a go because he's a distance runner, well, he needs a whole lot more calories than on the days when he's just hanging out at home in front of a screen. And I think that's fairly intuitive, but we actually do have to like think about that and make choices with our kids' nutrition. One of the tips that I give my teenage parents is that, you know, it's really hard for my teens to get fruits and vegetables during the school day. If they're packing a lunch and you're putting fruits and vegetables into it and it's coming home and the carrot sticks are gone and the apple's gone, okay, great. A lot of kids aren't doing that. They're skipping breakfast entirely a lot of the time. Some of them skip lunch entirely, or they're eating like the school food and they didn't like the vegetable that was on the plate and they didn't eat it. And so they come home and they've literally had 0 fruits and vegetables all day. They still need 2.5 cups because they're sitting at 0. And so cut up a bunch of apples, throw some grapes and a couple of bananas cut in half and peel some oranges and throw them on a tray and put them in front of you at the dinner table. If you cut up the fruit and you stick it in front of them, they'll eat it. you leave a basket of apples on the kitchen counter, and most of the time they just rot. I don't know how it is for y'all in your houses, but that's how it is at my house. But you cut up the fruit and you stick it on the dinner table and magically it disappears. So do that. You might have to do it every day if you know you have a child who's not eating their fruits and vegetables during the day. Exercise is supposed to be an hour every day if you are a child, and teenagers are children. So figure out how to do that. It's really hard if they're not doing sports because they don't have time, but find the time. See if you can, like I said, it down here, do it as a study break, to get up, do jumping jacks for 15 minutes when they're doing their homework, but figure it out. It's hard, you know, whether it's a trampoline or an app or whatever, find something they will do over and over again. And again, we're trying to build healthy adults, so try to find something they can continue to do for the rest of their lives if you can. And that's it. Those are my references so that you can see where all of that information came from yourself. And again, if you've got a teenager in your life who needs to do a project for school or whatever, hey, here's an easy starting point for them. So thanks.
Thank you so much, Dr. Balmoria. We are a little bit over time, so I don't know if you have patience to get back to, but if you have time for questions, we can see if anybody has any of those.
I do. I have a 11-and-a-half-year-old girl that's struggling with acne very badly. Anything that's not going to harm her skin or that's too harsh for her at that age to try?
So there are a ton of things that are available over the counter, and you know, the most effective treatment over the counter right now is adapalene, which is different. That's used to be prescription. It came off prescription, I want to say around 3 years ago now. And it's reasonably cost effective. I think it's like $15 for a tube. All of the good acne medicines are going to be drying and they're going to cause some redness. And so most of the dermatologists will tell you, use it with a moisturizer, especially when you start. You may even want to mix it 50-50 with a moisturizer to try to cut back on the drying aspect of it some. And the real problem that we have with teenagers is they just don't stick with anything that we give them. Girls are usually a little bit better about their skin routine than boys. Like they might actually be okay with like at least putting a moisturizer on every day. We really struggle to get the kids to actually use the treatment, whatever it is, on a daily basis. And they really have to use it for a solid like 6 weeks to really start to see a big effect. And so, you know, a lot of them, what they'll do is they'll use it like for a week or two and they'll be like, man, my face is kind of dry. It's kind of red. I don't really think my acne is any better. And they just stop using it. And then they come back and see me and they're like, yeah, my acne is not any better. And I'm like, what are you doing for it? Nothing. Okay, well, that was sort of what we would expect to see then, you know. There are a ton of prescription things out there that are actually for people who have reasonably decent prescription drug coverage, more cost effective than any of the fancy buy the whole kit from whichever, pick your pharmaceutical / skincare company and do their whole regimen. And so one of the things that I really counsel teenage parents about is like, please do not go spend like $700 on some like QVC, like acne treatment. Is such a waste of your money. Like you should be spending that money on, I don't know, a gym membership or veggies or something, not on a skin routine. Because most of the time, those of us who prescribe medications can come up with like 1 or 2 things with like a $15 copay and like fix it, you know? And so the one thing I tell people is please don't go throwing lots of money at this problem. It's not an expensive problem. So if you've kind of gone through the gamut of the over-the-counter stuff and you're not getting anywhere, come see us and let us fix it.
Okay, thank you.
Mm-hmm.
Any other questions? All right. Well, thank you so much for your time and attention today. And we will again post this on our website and on Facebook so you can share it with your friends. Thank you. Bye-bye.
Thank you.